Back on the blend this morning, we have Brady Hari, who is with Orthopaedic Rehab Specialist, Physical Therapy. Good morning. How you doing?
I'm doing well. Thank you for having me.
Well, I wanted to have you because fall is in the air, and I'm sure that along with that season, there are some typical things that happen to people that cause them to go see you.
Absolutely.
So let's talk about that a little bit.
Yeah, so anyone who is dealing with muscle weakness or wants to just help not fall, I would tell them to practice. Practice makes perfect, like we know, and anytime we are walking on uneven, unlevel surfaces, we are utilizing our sensory and motor systems, our cognition and our vision more than when we are on level ground. And the best thing to do with that is to train it like everything else. The more we train it, the more we're going to be able to retain that later in life when we are older.
That is a perfect scenario because it just happened to me. I was walking on a sidewalk that was covered with leaves. It was uneven, and I tripped and fell.
Oh.
Yeah.
Happens all the time. And when things like that happen, I also tell patients, maybe we need to look at your gait, the way you are walking. Do we need to slow it down when we aren't sure about the surface? Do we need to take smaller steps? Do we need to engage the core a little bit more to be more stable? Or simply, are you just dragging your feet and we need to work on strength to pick your feet up so something like that doesn't happen to you?
Or you're just clumsy.
Or you're just clumsy. Yeah, we can help with that too.
Well, talk about the types of treatments that you use with your patients at the clinics to help them with their balance.
Yeah, so at our clinic in Holt, we utilize a lot of different treatment options to help our patients. One, we have an Alter-G treadmill where we're able to unweight the patient and actually look at those gait mechanics through a camera. We can see, are we taking too big a step? Are we not picking up our feet? Some of those things we talked about earlier. We utilize a lot of free weights and exercise equipment to improve lower extremity strength. We work on balance and proprioception with non-compliant surfaces and just testing all the systems that we can there. And then also we have what's called a core stick, where we're able to engage the core while doing functional activity. When you may not actually think that you are using your core, you're using your core.
Yeah.
What about insurance? Do you take insurance for things like falls or things that happen during those?
Yes, we accept most insurances. If you do have any questions, you can always give us a call at the number that you're seeing on the screen. And the best way to do that is to have a referral from your primary care doctor. It just makes the transition just a little bit easier if you have that referral in hand when you are calling. You do not need it.
Okay.
It just makes it easier.
Okay.
So kind of.
Kind of.
Yeah.
Orthopaedic Rehab Specialist, Physical Therapy, ORSMI.com, or the numbers on the screen.
Thank you.